How to do a wet mount in the Family Health Center.
You'll find on your tray 2 slides, some cover slips, a piece of pH paper, a Q-tip used to obtain the vaginal discharge sample. You'll have this, which shows you the different colors according to pH. You'll have potassium hydroxide, or KOH, normal saline, a speculum, lubricating gel, and a pair of gloves.
Step 1. Determine vaginal pH.
So you're going to take the pH paper and you're going to just dab a little bit of the vaginal discharge on the pH paper, and you take a look, it turns green. So what pH does that correspond to? Well, we hold it right up to our test strip here and it looks like 5.5 is the pH there. So that would be alkalotic, okay? So if the pH is greater than 4.5, we think about bacterial vaginosis or trichomoniasis, and if it's less than 4.5, that's either normal vaginal pH or it could be a yeast infection.
Step 2. Prepare a slide with normal saline.
So you've got some of the vaginal discharge on the Q-tip. You're going to place that on the slide, and then this is the normal saline. 1 drop of normal saline, and remember, the normal saline allows you to see clue cells for bacterial vaginitis and also trichomonads from trichomoniasis. So you place a cover slip over your sample and then make sure you identify it with a label. I'm just going to put normal saline NS there.
Step 3. Prepare a slide with potassium hydroxide and do whiff tests.
So on your second slide, you're going to take, again, a sample of the vaginal discharge and place it on the slide. It's good to do this right away when the discharge has not started to dry up. You're then going to put a drop of potassium hydroxide on your slide, and right away you want to perform the whiff test. So you're going to just waft a bit of that towards your nose and see if does it smell fishy, does it smell like amines, and if it does, that's a positive whiff test, and that could indicate bacterial vaginosis or trichomoniasis, okay? So then once you've done that, you put on a cover slip and label your slide, potassium hydroxide. The reason we do the potassium hydroxide is because it breaks up the cells and it allows you to see the pseudohyphae and the budding yeast much better.
Step 4. Look under the microscope.
Now place the normal saline slide on the stage. You want to make sure the 10x objective lens is in place and turn the microscope on. Okay. Take a look at your sample. You can adjust the ocular lenses so that they line up with your eyes. And the first thing you want to do is use the coarse adjustment to get the sample in focus. Okay. Okay, so once it's in focus, you can also use under here the light adjustment to make it brighter or less bright, depending on what you need. Once that's in focus, next you want to switch to the 40x, okay, and then use the fine adjustment this time to get your specimen in focus. And if you need to, again, you can adjust under here the light level, and then with the fine adjustment you just adjust until you see the specimen well. Okay, and then once you've done that, next you want to look at the entire slide. So this knob right here moves you around the slide. So you want to take some time to go up and down and across your slide, back and forth, making sure to look at all planes so that you don't miss anything. And then of course you repeat that with the potassium hydroxide slide as well.
These are clue cells seen in bacterial vaginosis. They look like normal epithelial cells pressed in sand. These are pseudohyphae and budding yeast seen in candidiasis. These are the pear-shaped flagellated motile organisms seen in trichomonas. Here you see one moving on the slide.